Autobiography of Renal, and CNS. My drug name is Theomids. My generic name is Metamazole Profylthiouracil. My brand name is Tapazole or PTU. My chemical name is... And my drug classification is divided into two. For my therapeutic, I lower thyroid hormone levels by preventing the formation of thyroid hormone in the thyroid cells, which lowers the serum level of thyroid hormone, and it also partially inhibits the conversion of T4 to T3 at the cellular level. For my pharmacologic effect, I inhibit the formation and coupling of iodotyrosines in thyroglobulin because these processes are necessary for thyroid hormone synthesis. This inhibition induces a gradual reduction in thyroid hormone level over 2 to 8 weeks or longer. My pregnancy category is category D. For my mechanism of action, my major action inhibits thyroidal peroxidase catalyzed reactions by blocking iodine organification, thus preventing hormone synthesis. Profylthiouracil and metimazole, to a much reduced degree, inhibit peripheral deiodination of T4 and T3, slow onset of pharmacologic effects. Now for my pharmacokinetics. For my pharmacokinetics, absorption is in the gastrointestinal. My distribution is unknown. My metabolism, it is metabolized in the bile, and my excretion is through urine. Now for my indication. I as a drug is indicated for the treatment of hyperthyroidism. My contraindications includes allergy to any component of the drug. This is to prevent hypersensitivity reactions. Also for pregnancy, because of the risk of the adverse effects of the fetus and the development of cretinism. PTU is drug of choice for pregnant women. Also lactation, risk of antithyroid activity in the infant or the neonatal goiter. Also for pulmonary edema or tuberculosis, this is contraindicated with strong iodine products. Caution, I is used to treat hypothyroidism in Graves' disease, which are ineffective against grave ophthalmopathy, which is treated with glucocorticoids. In the first trimester of pregnancy, profylthiouracil is recommended during second and third trimester. Metimazole is also recommended. Now let's proceed to the side and adverse effects.
Hello everyone. Let's go to my side and adverse effects. Well, since I have a lot of classifications, wherein it includes thioamides, PTU, and methimazole, I will discuss each of my classifications, side and adverse effects. First, thioamides. Thioamides can cause drowsiness, lethargy, bradycardia, nausea, skin rash, and second is PTU, wherein it can cause nausea, vomiting, GI complaints, severe liver toxicity, and third is the methimazole, wherein it can cause a bone marrow suppressions. Methimazole can also affect your CNS, which can cause headache, drowsiness, vertigo, paresthesia, neuritis, neuropathies, CNS stimulation, which is fever, and also your cardiovascular, which is methimazole can cause edema, and for your GI tract, which is nausea, vomiting, salivary gland enlargement, loss of appetite, epigastric distress, and also my classification, which is methimazole, can cause jaundice, hepatic dysfunction, hepatitis, and for your metabolic, also it can cause hypothyroidism, hypoglycemia, coma, and for your musculoskeletal, it can cause arthralgia, myalgia, and for your skin, it can cause rash, urticaria, discoloration, pruritus, erythema nodosum, and exfoliative dermatitis. And the most important, which is the nursing responsibility. First, let's discuss the PTU. Administer PTU 3 times a day around the clock to ensure the consistent therapeutic levels. Monitor the response carefully and arrange for periodic blood tests to assess patient response and to monitor for my adverse effects. And also, in nursing consideration for methimazole drug, which wherein you have to monitor the complete blood count periodically to detect impending leukopenia, thrombocytopenia, aplastic anemia, and agranulocytosis. And also monitor the hepatic function and stop the drug if ever abnormality occurs. And also doses higher than 40 milligram daily can increase a risk of agranulocytis, which can be a life-threatening. And monitor for the patient's sore throat, fever, and general malaise, and report symptoms promptly. And watch for evidence of hypothyroidism, which is the mental depression, cold intolerance, and hard non-pitting edema. And notify the prescriber if the patient may need a need of adjustment of my dosage, and also stop me upon using if severe rash or an enlarge of cervical lymph nodes will develop. And for the patient teaching, you have to warn the patient to report for fever, sore throat, mouth sore, skin eruptions, anorexia, itching of the right upper quadrant, and or yellow skin or eyes. And you have also to tell the patient to ask prescriber about using iodized salt and eating shellfish, because the iodine in these foods may be take my maybe make me as a less effective, and also warn the patient that I may cause drowsiness, and advise the patient to use caution when operating machinery or vehicle. Instruct the patient to store me in light resistant container, and lastly, teach the patient to watch for evidence of hypothyroidism. So, thank you everyone for watching our video. We hope, me and my partner, that everybody who is listening to us learn something. Thank you.
So bye! And that will be the end of my blog for Autobiography of Endo, Renal, and CNS. I hope that you have learned something. God bless and goodbye. Stay safe!